Hello, and welcome to our presentation. My name is Sean, and I'm representing the group of me, Christina, Danielle, and Megan. Our topic today is talking about falls, and more specifically, falls with the elderly patients. Elderly patients are at an increased risk of getting severe or injuries with those falls, as bruising, hip fractures, or head trauma. How many times has a loved one called you in the middle of the night saying, I'm being rushed to the emergency department, I fell, and I think I broke something. That can be very mentally and physically draining on you and your loved one. Their quality of life can change severely. Things that they did before that fall, they can't do afterwards because of the injuries that occurred during those falls. So our objective is to get a long-term data of sorts on how to evaluate the quality of different methods to try and help minimize the risk of injuries that occur with the elderly with falls. Our proposal for the way that we'd go about doing this study would be do this for a 6-year-long observational study on what we can do to decrease these falls and decrease the injuries that were related to these falls. Such things as implementing vitamin D or calcium supplements, exercising programs, and then closely monitoring those patients that do willingly sign up for these studies, to closely monitoring them, those patients that have medications that can cause side effects such as orthostatic hypotension. Once you get up, you can have a feeling of dizziness, and we're just trying to minimize that, and we'll have close consideration and close monitoring for those such patients. And the way that we go about this is once we conduct with the hospital and the emergency department, and then the emergency department will get these cases with falls, and we then would go and see if they'd want to sign up. And then if they would sign up for this study, they'd get a vitamin D, a calcium supplement, and they'd also get provide exercise programs. And then the nurse would be providing education on the possible benefits of these interventions, just telling them how much your quality of life can improve with such regimens that we would be using for the study. And then the post-discharge, we would be following up the patient and monitoring their falls. Follow-up time of every 6 months would be sufficient enough to monitor for the incidence of falls. This would give us adequate data to tell us if their falls increased or decreased after implementing the changes spoken about in our presentation. And on top of just the falls, just seeing if they had a fall, if they had to go rush to the emergency department because they felt like something was different with their life, like something was broken or whatnot. The potential barriers that we might face from this method is to have these people on board. The most or some of the people that need to be on board are the doctors. The doctors need to be on board so that they can prescribe these medications that we believe that can help the quality of life of these patients. On top of that, we need the nurses on board so that the nurses can teach back these key vital points to these patients to just influence them to just stay motivated throughout this study, throughout the 6-year study, because 6 years, that's a commitment. And speaking of that, we also need the patients on board. Most importantly, we need the patients on board. They need to be on board, and we're going to give them incentives to stay on board. They can leave at any time. Just because they sign it after they fall that one time doesn't mean that they have to stay there for that whole 6 years. We're giving them the option that they can leave at any time, and they don't need to follow up at all afterwards. If they don't feel comfortable enough to stay in that study, they can leave, and there's not going to be any cost to them. It's just that we're not going to be bothering them with the 6-month checkup. This study is all hypothetical at the moment, as this is just our proposal for a long-term multidisciplinary prevention system for falls in older adults. This study is going to affect a big portion of our population, and an ever-growing portion of our population, thanks to modern medicine, as by 2060, according to PRB, which is our Public Reference Bureau, the population is said to, the older adult population is said to increase by 69%. People are living longer because, as previously mentioned, modern medicine, but the quality of life can be severely changed by such actions, as falls and such whatnot. So our study is to just enhance that quality of life and increase that longevity, because falls can cause severe and lethal, in certain situations, problems. So this study, if we can have these preventions working, we can have this population having the best quality of life that they can as they grow older. And we believe with this study that the results could show that. And with that being said, I'd like to thank you for taking the time to listen to this voiceover and watch our presentation. I hope you have a great rest of your day. Thank you.